Hi, I'm Dr. John Payne with Piedmont Reproductive Endocrinology Group. I'm a board-certified reproductive endocrinologist and infertility physician. I'd like to talk about embryo donation, sometimes called embryo adoption. Embryo donation is another option for women with the inability to conceive using their own eggs for many reasons, such as diminished ovarian reserve, or who have attempted IVF using their own eggs and have not stimulated or been successful. These women typically also have the option of using donor egg recipient IVF, but for one reason or another choose that that is not for them. Embryo donation with frozen embryo transfers allows the patient to be able to achieve a pregnancy and carry that pregnancy and undergo the experience of the pregnancy and delivery just as if the embryo had come from their own egg or sperm. The embryo donation process is in general cheaper than donor egg IVF, and so for financial reasons, some patients choose that over traditional donor egg recipient IVF. Donor egg recipient IVF does have the highest overall success rates as compared to embryo donation, but sometimes the rates can be similar. In general, the success rates with the donated embryos depends on several factors, including the age of the woman who created the embryos, the number of embryos transferred, and the quality of those embryos. Embryo donation requires doing a frozen embryo transfer cycle, and is very similar to frozen embryo transfer cycle with a woman using her own eggs and embryos, except for they're using embryos that have been donated. And the embryos are transferred into the uterus after the uterus has been properly primed or prepared to allow the endometrium to be receptive to those embryos. At PREG, the embryos that we have to make available for embryo donation were created by couples who were treated in our own practice, and they use the embryos to create their family, and typically they have a few embryos that are remaining in cryopreservation after they have completed their family and no longer wish to use those embryos for themselves. However, they don't want to discard the embryos or donate them to science or keep them frozen any longer, and they would like to have someone else have the opportunity to use those embryos to help them create a family also. The fact that the embryos have been donated from a couple who had success is very exciting. That in general leads to a higher probability of success that some of the remaining embryos will also be healthy and can lead to a pregnancy for someone else. At PREG, we follow the FDA guidelines that are required for screening of the donated embryos in a similar manner that egg donation is monitored by the FDA, and we do the appropriate testing as required. Once a woman decides that they would like to pursue embryo donation, the process is fairly simple. They'll complete an application and turn that in. That will basically get their name on a waiting list, and they'll be able to talk to the practice administrator and find out what the length of that waiting list is. Fortunately, our waiting lists have been fairly short, and within a few months to maybe 6 months, we've been able to match most of our recipients that have wanted to use the embryo donation process. Once some embryos are available to potentially be matched, those profiles are available for the recipient to review, and the profiles are somewhat similar to those that the woman might review when using a donor egg. Once they have selected the embryos that they would like to use, we then prepare for the embryo transfer cycle, which is similar preparation that the donor egg recipient had used. We require an evaluation of the uterus with the ultrasound and the saline infusion sonohysterogram, as well as the practice transfer or mock transfer, where we ensure that we can place the catheter within the uterus. We evaluate a few hormonal labs through a blood draw, and if the woman is over 43, she again should have the exam by her primary care doctor, an electrocardiogram, and a letter stating that pregnancy is not contraindicated for her. Once that has been completed, we can basically set up the frozen embryo transfer around her schedule, and she would have a meeting with the IVF nurse coordinator to undergo the FET orientation, at which point they would learn how to take all the different medicines which are needed for the frozen embryo transfer cycle. In general, the medicines are very easy to take and include a once-a-day injection after taking some birth control pills for several weeks, followed by estrogen patches, and then progesterone, which can be administered either intramuscularly or through vaginal inserts several times a day. And this will allow the priming of the uterus to be able to accept the embryo. The embryo transfer, again, is very similar to a transfer in fresh IVF or in donor-recipient IVF. Approximately 12 days after the transfer, pregnancy test would be obtained, and upon confirming that a pregnancy has been established, those pregnancy hormone labs will be followed for approximately 2 weeks to confirm continuation of the pregnancy, and then an ultrasound will be performed approximately 4.5 or 5 weeks after the transfer to confirm fetal viability and the number of fetuses present. At approximately 8 to 9 weeks after having become pregnant, you will be released to your OB physician for continued OB care.